So the session will be focused on the topic assessment and early intervention in children and adults. The earlier the better. First of all, I want to put a question mark here. Is the earlier the better? I'm not sure always if to do something earlier necessarily is something better. So I guess we have to prove that this is the case in a specific direction. So directed to diagnostics, but also therapy, but the whole process of therapy. And the question I guess we clearly have to also address some our thoughts on is early intervention necessarily something that does provide a benefit to children and or adults? So just to give you a brief introduction into what is out there in terms of data, this is an article I found that was recently published, which I think is worth knowing. It's scientific work that has been done on nearly 80 children. They have been separated in 4 groups, age from 0 to 9 months and up to 23 months of age when they received a cochlear implant. The groups, of course, were distributed not evenly, but at least things could be judged on. The main outcome parameter was the functional listening index up to the year of 4 years. So children were implanted at a different age, and further on you would follow them with a functional listening score. And the data that was coming out of the study is quite impressive. Just to make a long story short, and this has been depicted on the graph, the line that is going straight through is the line of the normal hearing children. That's the reference. And the color is the pink color is the age less than 9 months of implantation. The blue one is age 9 months till 11 months. Green is up to 17 months, and yellow is up to 23 months. And the most important thing is that when a child is being implanted, it does obviously make a huge difference if you're aged up to 9 months or if you're aged up to 12 months. And the line or the point of interest is where the line of development of the functional listening score crosses the line of the normal hearing children. So it takes about 2 years for a child that is implanted below 9 months to get to the level of a normal hearing child, while it takes about almost 4 years for a child that is up to 1 year to get the same level. Children that are above 12 months, up to 23 months of age, never cross this line of normal hearing development functional listening score. So 3 months of difference obviously makes a huge difference in terms of development of these children. This is a quite impressive data set that has been published. I have to say there's only little data out there that clearly shows evidence that what we maybe feel from clinical practice is also evident in terms of real data. So feeling is one thing, but real data is another thing. So setting the stage also means that we have to look on what we are talking about. So when we talk about assessment and early intervention, we cannot just look at a simple procedure. It's not about only setting or getting the indication straight or doing the surgery or maybe doing the fitting or rehabilitation or aftercare. It's a complex system where all these parameters depend on each other. If you change something on one side, you also will affect another side. So it's a process that has been decisive. So do we really talk about time then, or do we maybe talk about timing? Timing does mean that there's something being done and other parameters are depending on them. So you can't just switch on one side without looking on the effects on the other side.